Hello, I'm Gerald Boone. I'm going to speak a bit about what it's like to get a licensed marriage and family therapist license in the state of Tennessee. We begin with a question: what are the academic training requirements, including the number of hours in the program, specific course contents, titles, and the number of hours in a practicum or internship? In Tennessee, it states that you are to hold a master or doctoral degree in marriage and family therapy or an equivalent field from an accredited program, a supervised practicum internship of no less than 300 hours, which provides experience in the assessment, diagnosis, and treatment of cognitive, affective, and behavioral problems or dysfunctions in the current DSM. The next question is, what are the requirements for postmaster supervised clinical experience, i.e. the number of client contact hours, or MFT, number of relational hours, number of total hours, number of supervision hours, specific requirements of the supervisor? Now, this is a curious question because I reviewed some of the other states in reference to this question, and I found it to be a lot more thorough. In Virginia, I believe they have a list that you have to use. Tennessee is very different. For Tennessee, you are to complete 2 years of professional experience, which consists of at least 1,000 hours of face-to-face clinical practice and 2 hours of supervision by an approved LMFT supervisor. So just a little bit different. What examinations are required? Pass the LMFT exam and pass the Tennessee jurisprudence exam for LMFTs. What is the licensure title? The licensure title is licensed marital and family therapist. Is the license tiered, and if so, what are the titles and requirements? In Tennessee, I did not say that it was tiered. What is the scope of practice? The scope of practice for LMFTs is defined, and it gives the statute Tennessee Code annotated 6322-115 Part 5. LMFTs may practice marital and family therapy. Marital and family therapy involves the professional application of psychotherapeutic family systems theories and techniques in the delivery of services to individuals in the context of family systems theory and practice, couples and families. It includes the diagnosis and treatment of cognitive, affective, and behavioral problems and dysfunctions within the context of marital and family systems. They may administer and utilize appropriate assessment instruments which measure and diagnose cognitive, affective, and behavioral problems and dysfunctions of individuals, couples, and families as part of the therapy process or in the development of a treatment plan in the context of marital and family systems. LMFTs may not perform psychological testing intended to measure and or diagnose mental illness or prescribe medications. Let's hope the marriage isn't so bad that people are taking drugs. What if any miscellaneous requirements? Well, now they have a few. An applicant for licensure as a marital and family therapist shall pay the board a non-refundable fee as set by the board and shall satisfy the board that the applicant, 1, is at least 18 years of age, which I think I've done that, is of good moral character, has met standards set by the board no less stringent than the American Association for Marriage and Family Therapy standard for a clinical member, so long as such standards specify a minimum of a master's level degree and shall pass an examination as may be administered by the board. Applicants shall bear the fee for testing in addition to the review fee and application fee. So, I'm a little disappointed. I looked at Virginia. They've got a big old book on it, and it's very thorough. Tennessee, by comparison, was not nearly as thorough, I thought, as Virginia, especially in reference to K-Crep. I do not see K-Crep. And I really think that that's going to become the standard that you have to have in terms of education. And Tennessee, at least at this point, doesn't seem to have that, doesn't seem to require that. So that gives me a little bit of cause for concern, and I think that if I were to advocate, as was addressed in one of our previous modules, one of the things I would advocate is that it be K-Crep, because that is a standard that is more pronounced in most states. It just has a better, it just is better. It just is better. They need to do that. Thank you and have a good day. Bye.